Hi, Candace. This is Dr. Roy. Yeah, sorry this has taken so long to treatment plan. Couple excuses. I hate giving excuses, but with the mandate uh, set forth by the governor, dental offices have been in crisis mode trying to figure out staffing concerns. So I really apologize. If there's anything we can do to make this up to you, please let us know. Um, but I wanted to take some time to kind of share with you my concerns. I'm happy to meet with you in person, but I have found that these videos for patients have done the job to, avoid the patient having to come in for a consult. We're trying to minimize as much patient exposure as possible. And this seems to have been doing a good job. With that said, I'm happy to talk on the phone, I'm happy to email, and I'm happy to meet in person. You just let me know. So here we go. We're going to start with what are the issues with your teeth. First thing is spacing. Spacing is not necessarily a concern from the perspective of a dentist. It's more of an aesthetic concern for the patient. When you smile and you're looking straight forward, people that are looking from the side will notice this. Studies have been shown that is a less than desirable look. With that said, I don't try to tell patients they need to do something for aesthetics. I just want to point out to you what I see so that you understand, and then also knowing what the studies say. I'll let you interpret the necessity of treatment based on that. The second thing is what we call a deep bite. In general, our teeth should be more like this. Okay? This situation here is also an aesthetic concern, but it is also a functional concern. And the reason is the lower jaw, which is the movable part of the mouth complex, is what we call trapped. It takes a significant amount of muscle activity to go from here to edge, where the teeth are coming together. Whereas here, the teeth don't have to go as far. So think about biting into an apple. Your current muscle situation, they have to work very hard to bring the teeth edge to edge. And I can't make the computer do that particular movement, but you could imagine that the distance from the edges here and the edges here, edges of the lower teeth here and the edges of the upper teeth here, there's less distance to travel. So there's a functional reason. And over time, that can cause muscle imbalances, TMD or TMJ issues, so on and so forth. So from a biomechanical perspective, a deep bite like this is something that we tend to see a lot more problems. We tend to see patients with a lot more problems because of the fact that the muscles are so unhappy over the long term. It doesn't look like this has given you a problem up to this point in life, which is good. I would say 8 out of 10 patients that present with this have a lot of back teeth issues. It's very possible that your body has adapted to this, but we do know and understand that as time goes on, patients do lose their adaptation process, thereby starting to see more issues with the back teeth. I can appreciate that's somewhat confusing. That's an advanced concept in dentistry. It's hard to describe to patients, but take it for what it's worth. When we see deep bites like this, we tend to see more back tooth issues over the long term. So another reason to do something. We can see very small lateral incisors. These are unaesthetic. We can definitely improve those after we're done moving the teeth into their proper position. We can see uneven gingival margins. These two teeth should be at the same level. It's very possible that as we start to move the teeth, that we're going to start to notice that this gum tissue will start to recede, which is a good thing, which will then match up to this one. If in the long run you want us to do what's called a gingivectomy, it's a small, very painless procedure where we remove the gum tissue right here. That gum tissue was supposed to have receded when you were in your adolescent years. It didn't happen. There's nothing bad about it. We're just going to do it for the body since it didn't do it. With that said, sometimes when we move teeth, we actually do see activation of the gum tissue, and it does recede like it should have. I just want to let you know that when we're done Invisalign, there's a chance that this might not line up. The teeth are lined up. It's just the gum tissue didn't recede on this particular tooth here. So we're not going to correct that orthodontically per se. One thing I will say is deep bites are very difficult to fix. I don't want to say very difficult. They are less predictable. Are we going to see 100% resolution with orthodontics? Probably not. Given enough time, we can, and given what we call auxiliary treatments, we definitely could see something to this effect. The reason for that is the amount of force that's needed to push the teeth down so they line up like this, let's go ahead to the lower arch only, is rather substantial. And as adults, we tend to have pretty solid bone compared to when we're kids. If you were 13, this would be pretty easy. Bone is soft, teeth move fairly predictably, whereas in adulthood, this is harder to do. There are ways we can fix this, but they do involve higher levels of surgery, some more complex than others. If you want to have that discussion, I'm happy to have it with you. But doing a lot of this, I would find 98 to 99% of patients are going to say, let's intrude them as much as we can, something like that. And then whatever you end up with is what you end up with. It'll be a vastly improved situation. It just won't be perfect. If you are looking for perfection, I would say there's two surgical techniques. One which is straightforward, where we poke small little perforations in the bone. We numb everything up, and we create these little areas of inflammation that help to soften the bone so that we see more intrusion, something like this. This would be perfect right about there. The other method is to send you to the oral surgeon, and they will actually do something to the effect of sectioning your jaw and then putting plates on it. So it's an instant fix. It's just a very large orthognathic surgery. I haven't necessarily had patients go to that degree, but that is something. If you want perfection, let's have that conversation. If you're looking for significant improvement, I do feel very confidently that Invisalign can help us get there. How long do I think this treatment will be? Well, it really depends on how amenable your bone is to movement. It's very possible that we start moving and your bone doesn't respond very well to the forces of the Invisalign trays, in which case things may progress slower. When they progress slower, we sometimes have to involve another round of trays or 2 or 3 rounds of trays. It really depends on how the patient responds. The good news is there's no additional fees for this. This is all built into our fees and Invisalign's fees, so we could do several rounds of treatment if we needed. If I had to guess, I would say you would need 2 additional rounds for us to get to where I think you'll be happy and where I'd be happy. So keep that in mind. You come in, Chantel will scan you just like she did before. 3 to 4 weeks later, you get your new trays. Used to be 2 weeks, but with COVID, everything's backed up. So there's a slightly longer turnaround time, but we compensate for that so you don't lose any progress moving forward. Okay, so buttons. Let's see, attachments. I'm not sure how familiar you are with these. Buttons are tools that we use to allow the tray to exert force on the teeth more predictably. I like to use the analogy, if you had a post in the ground and you tried to pull it out of the ground, that would be very hard. But if you put a handle on either side of the post and then you started to wiggle it back and forth, you would have a lot more leverage. The same concept holds true with buttons. They're not red in the mouth. They are the same color as the teeth. And we place them on and then take them off when we're done with the orthodontic treatment. This poses no risk to your teeth whatsoever. They can have small issues like staining, but we can fix that very easily. As a matter of fact, we tend to not see much of that anymore because we're pretty good at placing these now that we have a lot of reps under our belt with Invisalign. That's pretty much it. I think the last... Yeah, I'm not going to talk about elastics. You don't need elastics here. I'm just going to introduce the concept. It's very possible that we may want to use elastics. What we would do is place a button very similar to the attachment right here, and then there's a slit in the tray, on the upper tray on this tooth here, and then we have you place an elastic that connects the two. And what that does, it helps to push the teeth backwards because we need to close this space here. If your teeth are stubborn, we may want to introduce the idea of elastics. With that said, I think you have a pretty good foundation where we don't need to introduce elastics for that particular movement. I just want you to be aware of anything that we might do. So most likely what we would do is you'd wear about 25 trays. We'd get to the 25th tray. We're not going to see your teeth look like this. They're actually going to look much better than that. We have to build in what we call lag. The trays are not going to move the teeth like the computer thinks. So that's why it looks like this. Keep in mind, we do this all the time, so we know what we're doing. We're trying to progress forward to an endpoint that we're happy with. We sometimes have to over-treat it in the software to get there. So that's pretty much it. I'm going to have Tiffany send this workup to you. If you have any questions, let's engage in an email conversation back and forth. My email is dr_roy@saccoriverdentistry.com. That's dr_roy@saccoriverdentistry.com. And I'd be happy to move the ball forward. There's several other things that Chantel will go over as far as how to wear the trays and directions and things like that. But I've hit the high points, the things that tend to concern patients the most from a clinical perspective. But I'm happy to answer any questions you may have moving forward. All right. Well, thank you for your time. And again, sorry this has taken some time. You have our full dedication and focus from this point moving forward. We've set some systems in the practice to kind of move forward with the mandate and the vaccines and all that. We're actually looking pretty good. So we'll talk to you soon. Take care.